Hey guys, welcome back. Today we're going to be talking about heartburn, what we call acid reflux, and its worst form, if it happens twice a week, it's called gastroesophageal reflux disease. Heartburn is suffered by almost everyone at one time or another. When it becomes gastroesophageal reflux disease, almost 20% of the US and anywhere between 7 and 30% of India will actually have it. And the symptoms associated with this are, as the name suggests, you feel a burning in your chest after you've eaten different types of food, lied down, did other things, and we'll talk about that. It can also lead to a bitter taste or a sour taste in the mouth, and other than that, it can give you chest pain in some cases with esophageal spasm. Now, what causes heartburn or acid reflux is that the lower esophageal sphincter, which is basically a valve at the end of your esophagus, is either incompetent or doesn't prevent the food in the stomach, along with the acid, from coming back up into the esophagus. And there's certain conditions under which that's the case. As you can imagine, what are the risk factors for it? The first is if you eat a very large meal, where your stomach gets overfull, and then go to lie down within 30 minutes of eating, that will definitely trigger it. In addition, there's certain types of food and other things which lower the tone of the lower esophageal sphincter, and those can include caffeine, chocolates, tobacco, alcohol, and there's a few others. Additionally, if you eat something which delays transit time through the stomach, meaning that it's high in fat content or grease or oil, then that may cause your stomach to be overfull and it can reflux up. Now, how do we think about this medically? When a patient comes to us with acid reflux, over-the-counter remedies or other lifestyle modifications, and the real question is, when do you work this up clinically? And in my opinion, it would be if you have more than 2 episodes of acid reflux per week, which makes it gastroesophageal reflux disease. Why is that the case? Because if you don't do something about gastroesophageal reflux disease, it can lead to complications. As you can imagine, the acid from the stomach will go and damage the esophagus, potentially causing strictures or other complications there. In addition to that, it can also lead to something called Barrett's esophagus, where you get a change in the types of cells in the esophagus. And then there's a small risk of cancers and things like that. Other complications from gastroesophageal reflux disease include associations with asthma, and they can also cause lack of sleep and other problems. So how do we treat this to begin with? If you have a patient who comes in, you first want to figure out how bad this is. And the simplest ways to deal with acid reflux in your life at home are to modify your lifestyle and watch what you eat. And what I mean by that is you want to decrease the abdominal pressures. So if you're grossly overweight, dropping weight will help with that. The second thing is to eat smaller portions more frequently than you would eating all in one sitting. The third is that never eat within 30 minutes of sleeping. That will help things. The fourth is don't wear too tight clothes, because that'll increase your intra-abdominal pressure. And so all of these are lifestyle modifications. The second part of it is what you eat. If you can stay away from spicy foods or foods which are known triggers for you, or alternatively alcohol, tobacco, chocolate, and a few other things which lower the esophageal sphincter tone, then that actually helps. Now, if you've tried all this and it still doesn't get better, then as a physician and general surgeon, we would see the gastroenterologist work people up. And the workup would consist of starting with a barium swallow, an upper GI with small bowel follow through. And what that means is you swallow a radiopaque dye, and it shows us the anatomy and to some degree the physiology of the esophagus, the lower esophageal sphincter, and the stomach. The things you're looking for are that are there any irregularities in the actual esophagus, Or is it not emptying completely, or is the stomach distended, or are there other factors involved? The second thing is doing pH manometry, where you actually put a device in which measures the pH, which is the acidity all up and down the stomach and the esophagus, to see if you're getting events where the pH drops in the esophagus, which would suggest that you are getting acid reflux, and it also tells you how often you're getting it. The third is getting pressures in the esophagus, the lower esophageal sphincter, and the stomach. Because in some cases, there's an abnormality in the esophageal motility or movement, or in the stomach movement, or in the lower esophageal sphincter. And then the fourth thing is to do a emptying study to make sure everything is going out of your stomach properly. With all of those studies, they're still going to suggest some type of chemical or medical intervention, meaning PPIs, which are proton pump inhibitors, or H2 receptor blockers, or antacids. And some of these things, since they're over the counter, may have already been tried by the patient. If all else fails, in some cases you have to opt for a surgery. And if you have recurrent reflux with complications, the types of surgery that would be indicated would be some type of fundoplication or wrap, which would augment the lower esophageal sphincter. And in most cases, it doesn't come to that. But in short, there are some other special situations where you may be susceptible to reflux. And they include in little babies. Most of them don't have a well-formed gastroesophageal angle, and therefore up to 10% of these kids by 1 year will continue to have some reflux where they spit up and do stuff. And in most cases, you don't do anything. In premature infants, you will sometimes do a wrap or do other things. And then the other group of patients who may have increased reflux are pregnant women, in that they have a number of things. One is a hormonal milieu, which may affect the motility as well as the lower esophageal sphincter. And the second thing with that is that you may have increased intra-abdominal pressures because the baby is growing and pushing pressure on the stomach, which will cause that. So in pregnant women in particular, they may be prone to reflux. In most cases, though, most of the same over-the-counter medications can work, but that's has to be discussed with your obstetrician to make sure that they're safe. So that's a little bit about reflux. I'm sorry you're going through it. I think we've all done it. And the bottom line is to try to avoid it as much as possible. I've given you some tips on how to think about it, how to take care of it, and how to prevent it. Now I want you to leave some questions for me in the comments below. And as always, if you've liked the video, hit the like button. Make sure to share it with all your friends, and make sure to catch my next videos by hitting the subscribe button and hitting the bell icon so that you get alerted when they come out. I appreciate you listening in and following me, and thank you so much for being here.